Thank you, Jeff. Appreciate the transition, and it's wonderful to have the opportunity to share a little bit about CareMessage and our work with the audience here. It's very exciting. So my name is Vineet Singal. I'm the co-founder and CEO at CareMessage. We are a nonprofit health technology organization based in San Francisco, and our focus is on helping healthcare organizations, particularly providers, in the safety net, federally qualified health centers, community clinics, free and charitable clinics, as well as payers, healthcare insurance providers, particularly those targeting Medicaid, managed care populations, to more effectively and efficiently communicate with these individuals, individual members and patients, to disseminate information, but also, as Jeff was describing, collect data and use that data in an actionable way that can be useful for the purpose of improving overall care. And I'll talk a little bit more about that later on in the presentation. The first thing I wanted to talk about is something that we all really understand, is the fact that I would say the most significant opportunity to make an impact for the AAA, and as Dr. Berwick was talking about earlier in the webinar, is really amongst the low-income patient population, specifically because this population tends to have a much greater risk when it comes to the usage of emergency services and hospitalization services, a greater risk of premature mortality, and significant preventable costs that can have a very significant impact. And one of the challenges that many of the organizations have, as Earhart was alluding to earlier in the webinar, is really the challenge of how do you do everything with just people? How do you complement the impact of people and humans and care managers with technology that can actually make them be more efficient and effective? And one of the things that we have realized at CareMessage is that the use of mobile technology, particularly the use of text messaging, is incredibly exciting. In fact, the use of text messaging in the United States, this is data from the Pew Research Center from 2011, which is the last time this type of data was released, is that the use of text messaging in the United States is inversely proportional to income and education, with lower income, less educated individuals using text messaging 2 to 4 times as much as individuals that are higher income and have more education. Text messaging also has a 99% open rate versus 28% open rate for email. So it is definitely the most ubiquitous and most inexpensive form of communication by far out of all the different modalities of communication. And what's also really interesting and exciting is that there's over a decade's worth of literature that demonstrates the viability and possibility of text messaging and improving care outcomes for diverse patient populations, particularly those in the lower socioeconomic strata. This is a study published in Health Affairs. This is a study that shows that from the University of Chicago that demonstrates with statistical significance that the use of text messaging saved on average about $400 per patient per year in preventable costs tied to improved glycemic control for patients with type 2 diabetes. And there are many other studies focused on smoking cessation, focused on preventative hospitalizations, ER utilization, et cetera, et cetera. So CareMessage, just to kind of give an overview of the tool that we have and the variety of different applications that we're able to offer this tool, is essentially an intelligent cloud-based technology platform that takes the possibility of using mobile-based messaging, particularly text messaging, and essentially enables any healthcare organization, but particularly targeting organizations that are serving Medicaid and uninsured patient populations, for the purpose of enabling these organizations to integrate this capability directly into the clinical systems and workflows that they're already using. So whether a provider is using an electronic medical record system or a health plan is using a care management system, our technology essentially acts as an extension of that capability and enables these organizations to embed and integrate mobile-based messaging directly into what they're already doing. And what's really exciting is that it uses the most modern forms of web-based communication modalities for the purpose of enabling these organizations to embed this capability directly into their daily workflow. So for the healthcare organization or the provider, the interface is intuitive, it's web-based. It can also be deeply integrated into what they're already doing. There's no IT management required, so IT, for the most part, doesn't need to get involved except during the initial integration piece. There's no maintenance required from the IT staff, and then for the patient, which is the most important component in this value chain, The exciting thing is that this does not require the use of a smartphone. So text messaging works on any device with text messaging enabled, which is the vast majority of devices in the United States. And what's also really exciting is that the vast majority of the population that we're serving has access to unlimited text messaging. In fact, the research shows that that number may be as high as 80% of individuals in the Medicaid and uninsured category have access to unlimited text messaging on their mobile devices, which is something that enables them to use this as a channel of communication with their provider or with their plan, and not have to do anything extra like install an additional application. This is behavior that they're already doing in many cases multiple times a day, and this is just an extension of that behavior when they're communicating with their provider, when they're communicating with their plan. So the different ways in which CareMessage operates and the different things that we offer our providers and our health plan partners, obviously one of the major use cases is reducing no-shows through automated appointment reminders. We also enable our partners to be able to follow up with patients or members regarding specific preventative visits, specialty referrals, prescription refills. There was a recent meta-analysis study that showed that the use of text messaging can double medication adherence for patients, and we're doing a number of studies tied to that particular outcome. We already talked about data collection, and Jeff talked about it in his presentation about patient-reported outcomes, but then also collecting data around patient satisfaction and patient experience is really important. And then finally, the most significant part of what we do is really enabling care management and disease management protocols to be more effective and more impactful through the use of automated messaging that is designed to essentially initiate some sort of behavior at the end of the day with the patient or with the member. So whether that behavior is helping the patient learn about how to do a foot exam if they have type 2 diabetes, or how to quit smoking, or how to manage their insurance benefits, whatever that behavior that we're trying to incite with that population, or whatever that knowledge it is that we're trying to imbue with the patients that we're trying to work with. We can have different interventions, and we have developed different interventions that can help our partners to be able to have that outcome at the end of the day. So in addition to the core technology platform, we also offer these individual programs that are specifically tied to a particular behavior that we're trying to incite within the population. And just as an example of some of these programs, this is our diabetes program, which is specifically focused on helping the patient, guiding them through the process of managing a difficult chronic condition. One of the things that we have realized in the over 160 healthcare organizations that we're working with right now is the fact that many of the patients that we serve often don't understand the basics of their condition, and often don't understand what it means to have a chronic condition, whether chronic means something that's ongoing or chronic means something that is life-ending. And obviously we want to make sure that patients first and foremost have a positive attitude about their condition, that they are in a position where they can actually manage their condition in a positive way. Obviously education is a very critical component, so our programs actually help guide the patient in an automated fashion based upon their answers to specific questions. So as an example, using the foot exam as an example, I'm asking the patient a question of whether or not they know how to do a foot exam at home, and then based upon their answer, either asking them if they've done a foot exam in the last 60 days or the last 90 days, but also teaching them how to do a foot exam if they don't know how to do a self-exam. And then relaying that information back to the provider, relaying that information back to the health plan as necessary. And then obviously empowering them with the tools and information that they need to take control of their health care. I'll talk about one specific example. We have a study underway at Stanford Hospital focused on women that are on Medicaid and are also pregnant and at risk for postpartum depression, which is a significant portion of women. And we recently implemented a technology feature that enabled the provider on the other side to receive a notification every single time a mom responded yes to the question of if she's feeling down or if she's feeling depressed. And what happened most recently was the fact that we indeed had a situation in which a mom who was feeling depressed was asked that question, and she responded yes. And the doctor on the other side was immediately notified, and that doctor immediately called that mom to address that situation. And that's something that would not have happened without the constant communication that we were having with this individual mother for the purpose of essentially assessing if she was at risk for postpartum depression and the eventual consequences of that. So this was something that was really exciting and just an example of the applications that the technology can have to, again, extend the impact, extend the reach of human beings. The other thing that's also really exciting about the technology is that our partners have the ability to build their own campaigns. They can actually build their own capabilities. And this is just one example from a diabetes perspective, the ability to build these automated programs that enable our partners to be able to, essentially using branching logic, be able to disseminate specific types of information, but also collect and elicit specific types of data back from the individual. It essentially creates a smarter, more personalized interaction with the end user. I think Don Berwick's earlier comment about how do you standardize something, but how do you actually personalize it at the same time? This is kind of our attempt at doing that, particularly from a messaging perspective. Obviously, targeting comorbidities, we understand that this population does not have sort of a one-size-fits-all approach when it comes to chronic disease management, and we understand that many of these patients have many different conditions at the same time, and also understanding that they often struggle with many of the underlying social determinants of health. So in the messaging that we provide to our patients, not only are we addressing the fact that they may have comorbid conditions, but also the fact that they may not have access to a kitchen where they can cook, or they may not live in a neighborhood where it's safe to go outside and exercise. So how do you address some of those barriers in the information that you're providing to the patient, in the resources that you're recommending to the individual at the end of the day? We take into account a lot of these different types of variables in partnership with the organizations that we're working with. And then obviously understanding that the key design principles of the work that we do is really human-centered. It's really about the individual patient at the end of the day. We interview hundreds, if not thousands, of individuals on a regular basis to really understand how they're doing, what are some of the core challenges that they're facing, and then take those insights, take those learnings, and embed them back into the programs, really focusing on extreme users, individuals that are really struggling on a regular basis to meet their basic needs that are influencing the way in which they're managing their health, and making that experience extremely tailored and personalized, obviously leveraging clinical expertise and the best-in-class evidence base. And then I wanted to talk about very quickly some of the data that we've seen from some of the implementations that we have run in the past. So one of the implementations that we had was at a managed Medicaid plan based in California, and we essentially doubled their ability to reach their patient population when it came to Medicaid re-enrollment. So essentially assessing which of their individual members needed help with re-enrollment and then helping them with that re-enrollment process. The first step in doing that is actually getting a hold of the member, and we essentially doubled their ability to do that, leveraging CareMessage. We also had a large federally qualified health center in Los Angeles that had a increase in their recall rate by 40% for patients that have been dropped off their eligibility list. So this is also really about engaging individuals that have been disengaged for a long time and getting them to come back to treatment. That's also a pretty significant use case for CareMessage. Many of our organizational partners have seen significant reduction in no-shows. There was a recent evaluation that showed that implementing CareMessage increases the likelihood that a patient will show up to their appointment by about 1.8x from baseline. And then another community clinic in Brenham, Texas, showed a 20% drop in their no-shows after implementing CareMessage, and the drop was consistent across multiple quarters. And then on the health outcomes and care management side, a Packard Foundation-funded evaluation at a free clinic in San Francisco demonstrated significant outcomes. 94% of the diabetic and hypertensive patients reported that CareMessage helped them better manage their health. And a recent pilot study that was NIH-funded and Stanford-led, 94% of sedentary patients increased their physical activity over the study period based upon accelerometer data, essentially pedometers, using CareMessage. And I think at the end of the day, the most important aspect is how does this make individual patients feel, and how does this actually impact the way in which they live their daily lives and actually interact with their healthcare on a regular basis. And this quote from one of our patients, that sometimes it only takes one word if you're down to elevate yourself. And I think it's just emblematic of the fact that many of these patients are actually hungry for more information and more support and more accountability. And CareMessage is one tool that can help them get there. So that's something that we're really excited about. As I was mentioning before, CareMessage is a nonprofit organization that is funded by institutional and individual philanthropic investors. We have a essentially a sliding scale pricing model with organizations that have the ability to pay for our technology, that pay a standard fee, and then organizations like free and charitable clinics and community clinics pay a very nominal fee or pay nothing at all. And that enables us to serve a wider range of healthcare organizations that can ultimately leverage and benefit from our technology. And thank you so much once again for the opportunity to share a little bit about our work, and looking forward to answering any questions they might have.